Hi, I'm Dr. Jaban. Let's talk heavy metals. Did you know that mercury can increase your risk for thyroid autoimmunity by 20%? And cadmium increases breast cancer risk by 63%? Lead decreases IQ by up to 5 points. These are all research studied statements that show that heavy metals can cause tons of issues to the body, especially if they're left out of control for a long period of time. So let's get down to some facts about what symptoms come from heavy metals, what you can do to get rid of them, and where they're coming from. So here we go. Symptoms of heavy metals are a lot of neurological symptoms. So whether that's depression, anxiety, moody, brain fog, memory loss, fatigue, those are just a few of the neurological symptoms. It can cause a taste of metallic in your mouth. It can cause smell to just go away, so you stop having the ability to smell. When I was dealing with Lyme disease and heavy metal toxicities, I couldn't smell. I couldn't smell anything that was on the girl I was dating. I couldn't smell colognes. I couldn't smell foods very well. So your sense of smell fades away. You get so tired, and some people get sensitive to chemicals. And that means that you're reactive to the scent they put in your car or the smell of a new car even. How about colognes and perfumes can set you off, or stuff that's supposed to smell good to keep a building smelling well makes you feel sick. That's the chemical sensitivities I'm talking about. Also, sensitivities such as to things on your skin, rings, or sensitivities to detergents or other chemicals put on your body. Now, where do you find heavy metals? Well, a few places are in food. So we've been familiarized with fish can carry mercury, but farm-raised fish carry so much more mercury. And also from there, you're looking at other foods. So apples can carry arsenic, so can chicken. So be careful with where you're getting your food. Make sure that it's organic and locally sourced. You want to make sure you know where that food's coming from, how it was raised, what it was fed. All right, so whether it's a pesticide, an herbicide, those are both types of chemicals that are going to cause an issue to your body because they have a lot of metals in them. Those metals are help to kill those organisms, so why wouldn't they kill you? Also, chemicals they use to kill rodents. Smoking is huge. There are so many chemicals in cigarettes, cadmium being one. That is one of the main places you get it, and it increases breast cancer 63%. That's an incredible increase in risk. We've also got paint. So they used to put lead in paint. So if you're living in an old home, there's a strong likelihood that there could be lead paint there. And that lead, remember, it reduces IQ. It also can cause issues such as osteoporosis. There's been some studies to show that lead being a positive ion gets into your bones and it can displace calcium, leading to osteopenia, osteoporosis. Family. It can be passed from family member to family member, meaning mother to child. So metals can go genetically because it's going from the bones that they have, the lead, and it's being transferred to their child because they're making bones for them in utero. So family, and then buildings. You can pick it up because as buildings are being built, they put things like asbestos and they put a lot of other metals and chemicals in these buildings that vape off or get into your system that way, or even if you're building the buildings and it's dust and everything getting into your body. So if you're a construction worker, beware. All right, so a few more facts out there. Arsenic can increase the risk of diabetes by 18% and gout by 52%. Those are incredibly high increases. And then lastly, how do we get rid of it? How do we get metals out? This is a tedious process. It's not 1 week cleanses. It's not 1 month cleanses. Sometimes it's not even just 3 months cleanses. You have to be consistent and it takes time. It's also possibly kind of dangerous. It can cause a lot of side effects, a lot of detox reactions as it's starting to come out of the body, and you need to use proper binders. So some of the popular ones out there are charcoals. Now, charcoals bind up pretty well, but they're not alive, so they just float through the bloodstream, and you've got to get them to run into a metal. So that's not as effective as other options. You can use zeolites, you can use chlorella and cilantros, but those last two, they're not as strong of binders, so they may grab some metal and move it and then drop it somewhere else, which can become dangerous. So you've got to know what you're doing with these. Make sure that you're at least passing that metal from one to another binder and knowing how those binders work in the body. Like charcoals stay typically just in the digestive tract. Next, We've got fasting. Fasting is an incredible tool. So when your body isn't worried about eating, it's worried about detoxification and healing the body. So many of my patients have done fasting, whether that's intermittent fasting, 24-hour fasting, or even getting to those longer block fasts are incredibly healthy. They actually help a lot with your mitochondria, causing the mitochondria to heal itself and break down the body fat around it to use that for fuel, which just again keeps on cleaning out the body, getting rid of old storage, allowing for the body to clean. We're going to go to ALA before I go back to carbon. So ALA, alpha lipoic acid, is one of the more popular ones out there when you're talking about detoxification. So that ALA will pick up and move some of those metals out of the brain, but sometimes you need to pass it off to the carbons. The bioactive carbons are one of the best things I've ever seen. I've used some of the other zeolites and charcoal products out there, even done it with patients for years. And as these new bioactive carbons are coming out, man, you can just see the incredible change, because one, the die-off and detox type symptoms from treatment protocols are not as heavy. And two, you're seeing these people that have done all these other protocols that still have symptoms. They come in and use these, and all of a sudden now they're having a little bit more detox symptoms, and they're getting better. That's the biggest key of everything for me, is they're getting better. Their blood work is changing, their symptoms are changing, their bodies are changing. So these bioactive carbons are awesome. If you're not using them, try them. But be careful, because anything that is effective can also have a risk, can also cause side effects. So I hope this was informative about heavy metals. If you're dealing with them, keep up the work, keep up the fight. You can get through it. If you need help, let us know. Thanks for watching.